Fine needle aspiration cytology, FNAC. Fine needle aspiration cytology, or FNAC, is a procedure that uses a fine-gauge needle to aspirate cells from a lump or a mass. For lumps that are palpable and superficial, FNAC can be done directly, but for lumps that are deep and not palpable, ultrasound guidance is required. Lesions commonly sampled via FNAC include thyroid nodules, breast lumps, enlarged salivary glands, lymph nodes, soft tissue masses. FNAC has many advantages. It is a simple outpatient procedure. It enables rapid diagnosis. It is economical. Sampling from multiple sites are possible in the same sitting. It offers high diagnostic accuracy. Other tests such as bacterial culture, PCR, immunocytochemistry, etc. are possible from FNAC material. However, FNAC does have its limitations. The tissue architecture is not visible, and capsular and vascular invasion cannot be identified. It is also difficult to differentiate in situ carcinoma from invasive carcinoma. Training and skill are required to perform the procedure accurately as well as for accurate interpretation of smears. The success of FNAC depends on the sample being representative of the lesion, as well as having an adequate number of cells for interpretation. The sample should be correctly smeared and correctly processed. Furthermore, the required clinical and radiological information should be available. A representative sample may not be obtained if the needle misses the lesion or if the needle samples an adjacent benign lesion. If the lesion is necrotic, cystic, or hemorrhagic, an adequate number of cells might not be obtained. Also, if the lesion is fibrotic, the yield of cells may be scanty. FNAC should be carried out in a designated room, which provides privacy. It should be well ventilated and well lit. It should have an examination bed, a writing table, and a chair. The patient should come for the FNAC with an FNAC requisition form filled by the clinician or a referral. Once the patient is identified, the procedure should be explained and any queries the patient has should be answered. Thereafter, informed consent should be obtained. A proper clinical history should be taken, the site of the lesion should be examined, and any relevant investigations should be perused. Contraindications for FNAC include bleeding diathesis, aneurysmal cysts, and hydatid cysts. Equipment needed: 22 to 23 gauge needles, 10 cc syringe, clean and dry label glass slides, sterile container with fixative, 95% ethyl alcohol, gloves, cotton swabs, surgical spirit, plaster. There are two FNAC techniques: the aspiration technique and the non-aspiration technique. FNAC using the aspiration technique. The site of the lesion is cleaned using surgical spirit. The needle is fixed onto the syringe. The needle is then introduced into the lesion. The piston of the syringe is then withdrawn to create a negative pressure inside the syringe. At the same time, the needle is gently moved to and fro within the lesion. When an adequate sample is obtained, the piston is pushed back and needle is then taken out of the lesion. The needle is detached and the piston is withdrawn again. Subsequently, the needle is reattached and the piston is pushed forward, expelling the contents in the syringe onto a glass slide. A smear is made by pressing another slide on the aspirated material and dragging the two slides in the opposite directions. The smears are put into a container with the fixative. A second site is aspirated using the same procedure. A plaster is put on the aspiration site. FNAC using the non-aspiration technique. Clean the lump with surgical spirit as before. Fix the lump with one hand. Insert the needle into the lump. Move the needle back and forth while it is within the lesion. Withdraw the needle and attach it to a syringe full of air. Push the material onto a glass slide. Make a smear with the aid of another slide and fix the smears with ethyl alcohol. Complications of FNAC are not common but include hematoma formation and bleeding from aspiration site. Intrathoracic FNAC can cause surgical emphysema, and aspiration of a hydatid cyst can cause anaphylaxis.